Hey you guys, welcome back for our daily practice questions. As always, I like to get into my introduction and disclaimer before starting on any of our content for today. So for those of you who are familiar with me, hey y'all. For those of you who are new here, welcome, welcome, welcome you guys. I am Dr. Brittany Weinstock. I am a family nurse practitioner and I'm the founder and CEO of the Nursing Studio. I provide resources, tools, courses, review books, and more to assist nurses as well as nurse practitioners with success on boards as well as in practice. I have been doing this since 2015, assisting nurses and nurse practitioners internationally with a 99% pass rate on all of our courses and a 100% pass rate on our one-on-one sessions. Now, I always like to give the disclaimer and reminder that we know there's no absolutes in medicine. We treat on a patient-by-patient basis. And just to let y'all know that any of the questions that I provide are designed based on the guidelines that are currently being tested on the ANCC as well as the AANP. And if I'm ever teaching or doing videos on things that we currently do in practice, I will always say that so there's no confusion, okay? So with that being said, let's get into the questions for today. All right, you guys. Question number one for today states the nurse practitioner and NP student noted an area on the patient's arm that is flat with no noted elevation and appears to be a blemish. The NP student is inquiring on how to document this finding. What is the best term for the noted skin finding? Is it A, bulla, B, papule, C, pustule, or D, macule? Take a moment and tell me what you got in the comments. All right, you guys, I always recommend reading the stem of the question first so that you can ensure that you're answering what is even being asked of you. I know sometimes it's like, all right, you're just trying to get to the questions, but trust me, trust me, trust me. Read the stem first, slow down, and then go and look at the bulk and the scenario in the paragraph so that you can slow down and make sure that you're not creating your own storyline, right? So the stem of the question here states, what is the best term for the noted skin finding? All right, so what's skin finding? Patient has a flat area on their arm with no noted elevation. It appears to be a blemish. Okay, so you got to know your those dermatological terms and which parameters fall under which, right? So is it A, bulla? Well, you should know no. Bulla is it's like a blister. It's fluid filled, 1 centimeter or larger, right? So I always say think bulla and blister. Bulla and blister looks like to me because it's fluid filled. So I think of full, Full, like full of fluid, and then blister, put a B on it, make it bull, like in bulla. I know that's crazy, but Brittany's brilliance. That's where my mind goes. So if it helps you, I hope it does. But yes, a bulla is a fluid filled like blister that is 1 centimeter or larger. Okay. Is it B, a papule? No, papules are more like pimples when you think of it. So, like papules are small, they're less than 1 centimeter, and they do have elevation. This does not have any elevation, right? And then C, pustule, even if you didn't know, this description says no elevation. If something has pus in it, there's going to be some form of elevation, right? But a pustule is also small and less than 1 centimeter, just like a papule. The difference is it's elevated, but it's filled with pus. So let's go back. A bulla is fluid filled and it's 1 centimeter or larger, right? A papule is small. It's less than 1 centimeter, but is elevated like a pimple. A pustule is just like a papule. It's small and less than 1 centimeter and elevated, but it's filled with pus, okay? So that leaves macule. D, that's the answer, macule. And if you've done any of my videos and know any of my courses, Brittany's brilliance, I say, with macule. I think of MAC makeup because a macule is something flat without elevation. An example of a macule is a blemish. Like, think of a blemish on your face. It's a spot. It might be darker in color so that it is identifiable, but it's flat. It's not elevated. It flows with the skin, And I say think MAC makeup because we use MAC makeup to cover our blemishes. So macule, flat, no elevation, okay? All right, question number 2. A patient presents to the office today with complaints of flu-like symptoms. Upon assessment, the nurse practitioner notes a bullseye pattern rash to the patient's left forearm. Based on the findings, how should the nurse practitioner treat? Is it A, doxycycline, B, topical hydrocortisone, C, levofloxacin, or D, no treatment is required, it will resolve on its own? Take a moment and tell me what you got. All right. So, stem of the question states, based on these findings, how should the nurse practitioner treat? If it's asking for treatment, I always tell y'all, run it back, right? If we're treating something, we have to know what the diagnosis is. If we diagnose something, we have to do an assessment to get to the diagnosis, right? So you got to run it back and see what you got going on. So there's no provided diagnosis yet. So it says that the patient came in complaining of flu-like symptoms. That's those subjective findings, right? What they're stating is wrong. Then the nurse practitioner observes and notes a bullseye pattern rash to the patient's left forearm. Key identifier, right? Like the alarm should ring when you see a key identifier, and you should be able to associate the stuff. You know how I say when I do my teaching, y'all know I'm good and crazy, but this is where my brain goes. And if I can dance or sing or do something, that's my thing. So anyway, when I say stuff like this, I'm like, when I say this, you say that. You know what I'm saying? So like when I say bullseye pattern rash, what should you say instantly? My MPs, what should you say? Lyme disease, right? You should instantly think Lyme disease, hands down. And so also we know that Lyme disease, and if you don't know now, you know, with Lyme disease, commonly they will first present with those flu-like symptoms, right? So this person has classic presentation of Lyme disease. So in the event of Lyme disease, what are we treating with? Your best answer is A, doxycycline, okay? Doxy. All right. All right, question number 3. The nurse practitioner has diagnosed the patient with bacterial vaginosis today. While reviewing the patient's history, the nurse practitioner notes an allergy to metronidazole. Based on these findings, how should the nurse practitioner treat? Is it A, flagyl, B, clindamycin, C, augmentin, or D, levofloxacin? Take a moment and tell me what you got in the comments. All right, you guys. So, stem of the question states, based on these findings, how should the nurse practitioner treat? Again, if we're treating something, what are we going to do? We're going to run it back. We're going to see what the diagnosis is. If we don't know a diagnosis or have a confirmed diagnosis, we're going to figure out what assessment findings we have to come up with a differential, right? And y'all, don't make this such a memory style thing. When you get these scenarios, when you sit down at boards, this is what I tell my people, especially when we're doing one-on-one sessions, because this is something that I commonly see y'all do. Y'all start to try to run through the things in your mind, like, okay, they have this, so I do this, I do that. And that's good because you have that muscle memory. But you have to be able to apply it. That's what's going to give you the success on boards. That's what's going to give you the success in practice, right? This is how we move. You already do this every day. This is what your background is. You know what to do. So don't step out of your nursing mindset on how we funnel through patients. Don't come out of that provider mindset on what you do when you encounter someone, assess them, and come up with the things and just go straight to trying to recite things. You got to tie it together. You take that knowledge foundation and apply, right? So just go through the steps. But here we already have the diagnosis. The patient has bacterial vaginosis, right? So what is our first treatment option for bacterial vaginosis? You would instantly think flagyl, right? But because you have to slow down and pay attention to what they're saying, this patient has an allergy to metronidazole. Also, this is why you need to know your generic and brand names. Metronidazole is flagyl, right? So we can't give flagyl. So you want to take A off of here, right? Can't do that. And your answer is B, clindamycin. Clindamycin is that next antibiotic that we use for the treatment of bacterial vaginosis. If you can't do flagyl, go with clindamycin, okay? All right, you guys, I hope you found this helpful. As always, be sure to like, comment, subscribe. The subscription helps the channel, and it also helps so that other NPs and nurses can see this to help with their studying as well. I appreciate all the sharing with your classmates. It does not go unnoticed. Thank you, thank you, thank you. But as always, make sure y'all meet me back here. And if y'all need any of the resources to further assist you with your studying, contact the Nursing Studio. We have review books. Our ebook option, if purchased, you have instant access to that. You can access it on all devices so that it's good for studying on the go. We also have a paper book app, option that is shipped to you from Amazon. Those two links are in the bio of this channel to assist you for ease of access, along with our website where you can see everything that we offer. We also have a self-paced review course where it is broken down by system, each system on here, including non-clinical content to prepare you for each exam, as well as practice questions, a few quizzes per system to tie your knowledge all together. You can listen to this as many times as you like. There are videos of me just teaching you and walking you through all the things with my mnemonics. And then we also offer one-on-one sessions. With our one-on-one session, it is all based off of what you need. If you're just struggling with one particular area, then our session is for that alone, just trying to get that weakness to a strength. If, say, you've had an unsuccessful attempt on boards and you need our custom package where we look and see what your weaknesses are, we structure your studies, and then we formulate a plan and study alongside with you, then that's our custom package. And sometimes you just don't know what you need, but you know you need something. And you may just need some advice, tips, guidance. Just give us a call. That's the best way that I can assist you. Give us a call at 803 400 6864. You can even shoot a text message to that number, or shoot us an email at the nurses studio, the number 1 at gmail.com, and we'll get back in touch with you briefly and try to help guide you on that path. Okay. But as always, you guys, meet me back here. Happy studying. Bye, y'all.